Hello, everyone. Welcome to one in a series of conversations we're having about how artificial intelligence is changing mental health treatment. At Matter, our mission is to accelerate the pace of change of healthcare. We run an incubator for healthcare startups and have supported more than 1,000 companies from around the world that have raised more than $5 billion now to fuel their growth. We run 6 or 8 accelerators a year in partnership with large health systems and life sciences companies and payers. And we're currently running several, one that's focused on oral health, one on family caregiving, two on health equity, and one on the mental health of young professionals. We also work with large enterprises, helping them build their innovation capabilities with a suite of education and training and insight services that help them make sense of emerging technologies and figure out how to harness them. And we feature extraordinary individuals at events like this who are on the forefront of changing healthcare and improving health. And our guest today, Danny Fried, is one of those people. He is the founder and CEO of Blueprint, which he will talk more about. Prior to starting Blueprint, he led product and design at Trunk Club, not a healthcare company. So we'll talk about that. And co-founded Companion, which is was a personal safety and security app that had a rocket of a ride. Um, so Danny, thank you for joining us today. I am looking forward to our conversation, and welcome.
Thank you. Looking forward to it as well. Super excited to be here.
Well, thanks. And for everyone else in the audience, if you have questions, please use the Q&A function, and I'll try to weave them in along the way. Danny, we have a mental health crisis in this country and in many parts of the world. And I want to spend most of the time talking about how artificial intelligence can help improve mental health. But I first want to get to know you a little bit more. You weren't in the healthcare industry or the healthcare technology industry uh, before you started a mental health company 6 years ago. Um, how did this happen?
Yeah. Um, as you sort of alluded to, I come from a couple of experiences that are very much outside of healthcare. So prior to Blueprint, I spent about, I think it was a collective 7 or 8 years designing, building, and launching a couple different consumer-facing software products. So the first was a company called Companion, which I started while I was in college at the University of Michigan. In about 2013. And Companion was a personal safety app. We helped people get from point A to point B safely. And we went on a pretty wild ride. Like you said, we acquired about 3 million users in the course of about 18 months. So I fell in love with the process of building big products with small teams through that. I also discovered how hard it can be to build long-lasting consumer products and consumer businesses. So did that for a couple of years. We ended up winding it down. I still had the sort of consumer itch, so I moved out to Chicago, which is where I'm based now. Joined a startup called Trunk Club. Was on the product and design team there for about three years, I think. And then I left to start Blueprint and try and reinvent mental health care. It's obviously not a linear or maybe even obvious path of how I got from consumer to mental health or healthcare more generally. But for me, the whole reason I got sucked into this world is because along the way, I lost one of my best friends to bipolar disorder. And the thing about my friend is, in some ways, he was fortunate in that he had access to care, which not everyone has. So he was seeing a therapist, he was seeing a psychiatrist, he was on medication. But at the end of the day, care didn't work, and he died by suicide between appointments. So that was the start of this journey for me. That was about 10 years ago. I knew virtually nothing about, let's say, mental health care. I knew very little about healthcare too, honestly, at the time. And I didn't turn around and start Blueprint, but I did sort of turn around and start myself on this journey of just trying to better understand what my friend had been going through, first and foremost, because I knew so little. And then sort of one thing led to another. I started to talk to a lot of smart people in the space, and I started to pick up and then fixate, and then I would say eventually obsess over some of the problems in the space, and then eventually sort of felt like I had no other option but to spend every living hour and minute focused on some of these problems, and eventually Blueprint was born. We got started in 2019. So that's sort of the backstory of how I got here.
What was the so you lost your friend who had access to quality healthcare. So there wasn't an access issue, but it didn't work. And in physical healthcare, I mean that happens. Like you can go in for a routine procedure to do something else, and you know a friend who never woke up after that. I mean, that these kinds of things happen, but with therapy, I guess, and just talking to you previously, it sounds like one of the insights that you had when you were really digging into his experience and just trying to understand what his journey was like and why it didn't work was that there is a tremendous amount of variability in the outcomes that are achieved by people who are in therapy. And I wonder if you could talk a little bit about that and what was the sort of key insight that uh, you were then able to sort of pivot that or wrap around that and say, oh, there's a company here
Yeah.
and something that can really make a difference here.
Yeah, there's just a lot of trial and error in mental health in particular, whether it be therapy or even prescribing medications. There's a lot of trial and error. And so I don't think we yet fully know sort of like the be all end all. It's not like the solution is super obvious, but if you just think about the problem of there's a lot of trial and error, and every trial it sort of increases the risk of a negative outcome, or in my friend's case, unfortunately, as a death. And you can almost think about that as eventually as a computational problem. The problem is when we got started, and this has started to change, but when we got started, there wasn't even data to go in and start to break down why or what or who or when. And so when we first got started, our sort of like the first problem we put in our crosshair was, hey, there's just no data flowing when it comes to mental health and mental health care. And so how do we start to collect outcomes data at scale, ultimately so that providers on a one-to-one basis have access to that data, hopefully to inform care. And really at first, it wasn't even to eliminate trial and error because we didn't really have a path to do that. But hey, can we at least shorten the amount of times it takes and the duration of time it takes to sort of go through some of these trials and error? And hopefully that would help. And there's a bunch of research backing this approach. It's called in the industry measurement-based care. And if you actually step back and think about what measurement-based care is, it basically says if a provider is using data to help inform decisions, they're going to be more effective, sometimes to the tune of 2 to 3 times more effective, and they're going to reach a successful outcome more rapidly, which makes a ton of sense because the opposite is they're not using data, right? So this is a tool to inform decisions. It's not a tool that makes decisions, but that was sort of step number one. And then sort of as we got on further and further on that journey, the product and the platform and the company continued to evolve. But that was sort of like core problem number one that just felt so broken that that also felt achievable to at least start making a dent in.
And is your focus, or at least at the time as you were thinking about this, your focus more on psychiatry or on psychotherapy? And is everything that you just said equally applicable to kind of both uh, elements, or more one or the other?
Yeah, I think our focus as a company sort of always has been and continues to be on therapists first, but there's a lot of overlap. For example, we work with organizations who employ both therapists and psychiatrists. And so what we do now and sort of the role we view ourselves is really this technology that enables those practitioners to do their best work, to be as effective as possible and as efficient as possible, in part by having access to better data at the point of care. We're much more focused on therapists because if you look historically, we feel like they've been underserved. And if you look at the number of mental health professionals, there's about, when you include all the different types of therapists, it's about 700 or 800,000 in the US, and there's about 30,000 psychiatrists. And so we're going after that therapy market first and foremost, but we end up serving a number of psychiatrists as well. Some psychiatrists also deliver therapy. They're just also prescribing medication. So there's a lot of overlap, but we definitely focus first and foremost on therapists.
Wow, so there's 7 or 800,000 mental health professionals, um, and I think a lot of them are not affiliated with large practices. A lot of them are sort of, you
Yeah.
know, kind of hang a shingle and have a practice, right?
Exactly. Yeah, it's something that the data on this is inherently murky because of the makeup, but it's like 70 to 75% estimated number of therapists who are individual practitioners. So it's N of one, that's their organization. It's just them. They serve probably 20 to 30 clients at most at any given point in time. And then there's another cohort of, call it like 10 or 15% of the market that is sort of like small groups. These are still sort of SMBs. It might be 5 therapists who have banded together, or 10 therapists, or 20 therapists that have banded together, but very much still operating like a small business. And then there's about 5 or 10% of the market that has been sort of like professionalized. Most of those are not within health systems or hospitals or academic medical centers. There's certainly some, but most of those actually now are tech-enabled companies that have typically either raised some venture capital money or some private equity money and have done some sort of like platform play or roll-up play and are sort of aggregating therapists and trying to also improve access or quality or something else.
Well, I want to come back in a minute to just from the business and the entrepreneurial aspect of what you're doing. Like, how is it that you go to market in a sort of a situation like this? Because it's very different than many or most of the healthcare companies that certainly that we work with. But I want to talk a little bit more about first, like, what is it that you're actually doing? And there are companies out there that are harnessing AI and in a sense that, if not replacing the therapist, is kind of doing a lot of the work that they would otherwise do. And then there's your company, which is, I think, not doing that, and that you're more focused on enabling and empowering therapists. And I want to talk about one, why you took that approach, and then let's talk about what it is that you're doing.
Yeah. Yeah, there's a bunch of ways to think about what we do, but I think the easiest, especially for someone brand new, is almost think of Blueprint as a co-pilot for a therapist, an AI co-pilot for a therapist. And so we sit alongside the therapist. We view ourselves as someone who supports and backs up the therapist. We're like their sidekick. And I think that is there's almost two schools of thought within AI in any industry you look. Are you sort of replacing the person and the work they're doing and achieving some similar level of outcome or better outcome or cheaper outcome or what have you? Or are you more the co-pilot where you're supporting the person, making them more productive, making them more efficient, making them more effective, whatever it might be? We're very much in that latter camp and sort of always have been, just in terms of the nature of how we got started. The way we even describe ourselves to therapists is really a tool to enable them, right? And so we do that. There's sort of like two umbrella lenses. We do that. Number one is efficiency. Number two is effectiveness. And so we have two products, one product in market, another product coming hopefully in the next few weeks by end of September. The first is really focused on helping to automate documentation. So how do we take the thing that therapists hate typically the most? It's sort of like almost always at the top of the list of things therapists hate the most, which is the paperwork they have to do. And how do we use AI to automate that? I can talk more about how we do that. And then the second product we're launching really focuses on serving up insights and suggestions and guidance before a session starts, during a session, and after a session, both based on the insights we've garnered from previous sessions, but also based on input from the client or patient, maybe between sessions. So pulling in data from all sorts of places, but ultimately with the purpose of giving that therapist more data in a really easy to understand and digest and really actionable way, so that they can do what they need to do. But the technology again is there to support them.
So I can talk a little bit more about that. So one of the things I know that you do is like note taking, and that saves the therapist, I think, a ton of time every week. And so break it down a little bit in terms of how what is that? How are you collecting the data that you're then analyzing? How are you analyzing it to provide these sorts of insights and be that co-pilot to help therapists kind of operate again more efficiently, as well as and actually would love for you to maybe break that down a little bit, because one is operating more efficiently, and we see lots of healthcare companies that are, there's lots of scribe companies of one sort or another that sit in a physician's office in one way, or another, and they're listening, and they do documentation or things like that. Um, and then there's the quality piece, which I think was sort of how you got started in this,
Yep.
of looking at, how to, uh, I can't remember the words you just used because my brain isn't working, but a couple minutes ago about, measurement based care or something like that, that that's sort of making it easier and more possible for more therapists to use these kind of evidence-based approaches, and really being data driven. So if you kind of think about it in terms of that
Yeah.
efficiency play, and then that efficacy play, um, go a little bit deeper into what it is that you're doing and how you're doing it.
Yeah, for sure. Well, first off, like it's very much efficiency first. So one of the core realizations during the, call it like 5-year journey before I even started the company, of just like immersing myself in the space, was this realization that therapists are extremely busy. So are all healthcare professionals, but therapists included are extremely busy. Especially when you think about sort of the crisis from the lens of access and even supply and demand, right? Like they're very much in demand, and so thus they're very much in back-to-back sessions all day, every day. They maybe have 5 or 10 minutes in between sessions, and then they're tasked with all sorts of documentation work that has to happen. And it typically today it happens after hours or on nights or weekends. And so that causes a bunch of burnout. So it's very much efficiency first to then create the space for quality. But the way our note taker product works, a therapist clicks record in our portal. We then record the duration of that therapy conversation, that therapy session. That audio then gets sent to our system. We use AI to transcribe it and to summarize it, and ultimately to generate a clinical note. And there's a whole bunch of layers there, including like the audio's auto deleted and we never store it, to sort of really keep privacy and data security top of mind. But ultimately, they get the output of this 30 seconds or 60 seconds after this therapy session concludes. They get this really accurate, really high quality, really compliant clinical note, whether that be an intake note or a progress note, whatever the situation is for their needs. It's like I said, it's really accurate. And so they may make a couple edits, but most people don't even need to. So they review it, make sure it looks good. And then either they've got a direct integration into their EHR, or they can copy and paste it. And so it's another 1 or 2 clicks, and away they go. And so if you just think about the impact this has, there's a bunch of ways to look at it, but one of the data points that we ask in a bunch of surveys is, when are you completing your progress notes? And before Blueprint gets involved, it's often at the end of the day or at the end of the week or on weekends or whenever I can. And then you compare that to once they've started using Blueprint and adopting Blueprint, and it's almost always at the end of the session. It goes from something that took 5, 10, 15, 20 minutes, and thus they weren't able to even complete in between the session, to now it takes 90 seconds, maybe review, edit, copy, paste, boom, they're done. And so then the end of the day comes, and they can go home and they can spend time with their husband or wife, and they don't have to catch up on all their notes and then do it again all the next day. And this sort of queue builds up. And so that's how the note taker products works.
And
And
presumably the notes are better if you could do it right away. I mean, I know if I try to wait until the end of the week to take notes on the meetings I had during the week, like it's a bunch of garbage. So
totally.
presumably it's better quality information that gets recorded, right?
Better quality information, and the way we've trained our models is part of the purpose of these notes is not just for their own benefit, but really like the clinical note is also for the sort of documentation purpose, and to be in compliance. And so we've sort of trained the model with that too. So it's definitely a better note from that perspective. The other interesting thing that we actually sort of stumble into this, but it's feedback we hear now all day, is now that I know I've got this note taker and Blueprint has my back with notes, I don't have to worry about typing or writing down notes. I can actually just focus on my patient. And so it's this like freeing thing also. I think we haven't done any research on this, but I have a hunch that that actually does trickle into quality. You're able to deliver higher quality care as a result, because you're listening and hearing and focusing on your patient, because this thing sort of has your back in the meantime.
Yeah, I would think, I mean, intuitively it makes sense. So I'm willing to go with that. And have you run into issues? I mean, you said you the audio doesn't get stored, it just gets deleted right away? And are there transcripts? Are there like, is there anything there, or you've kind of worked through all that, and everybody, every therapist has notes in some system anyway. So you're beyond that. You're not opening any other sort of doors related to security and of data.
Yeah, I mean, on the data security front, I would say we had been in we launched that product only about 8 or 9 months ago, something like that. And so we had it's now sort of become the centerpiece for us in many ways. But when we launched that, we sort of had I guess the hindsight and the foresight to know that, like, hey, in this space, in mental health care and in any space, but in particular in mental health care, like the privacy and the data security aspect is huge. And now we're actually going to ask these clinicians to open up their four walls or their virtual four walls and sort of let us in and let this technology in, and not just let us in, but actually let us listen to the contents of a session. So it's a big ask. And that is like the number one thing we focus on now, is how do we build trust through this interface? But we had the foresight and the hindsight to really focus on building privacy and security in from day one, both from a technical standpoint and the encryption and the HIPAA and the SOC 2 and all that stuff, but also some of the features we built in, like the recording's gone. So it doesn't even exist. And that poses some challenges up front, but we sort of had the ability to sort of step back and do that because we felt like it would be really important. And ultimately, the best product here will win, but part of that means the most secure, the most trusted, the most private, given the nature of the product. There's all sorts of like odds and ends in terms of challenges and difficulties when it comes to capturing audio and transcribing that accurately and using that to summarize and generate a really good note. We've gotten really good at it. There's still sort of a never-ending chase down of those things because you're dealing with the real world and different microphones and computers and rooms and all sorts of stuff. But we've gotten pretty good by now. We've now done, last week we crossed 12 million minutes of recorded sessions in the last 6 months or so. So more to go, but we're definitely on our way.
All right, so a few follow-up questions from that. So one is just, there must be some percentage of patients that freak out when they find out that they're being recorded. Like, what does that look like?
Yeah, there's definitely some, but less than we thought and less than our customers thought and less than you'd probably expect. We don't measure it, but anecdotally, it's what we hear is it's, probably to the order of magnitude of like 5 to 10% of patients who are just not comfortable for whatever reason. And so we have a solution for that, which is the therapist at the end of the session can, instead of recording it, just dictate a summary so they can talk to our tool and explain the contents of that session. It's still fresh in their head for the most part, and they can still get a pretty good note as a result. But it's 5 or 10%, and we have sort of some of the consent process that we recommend therapists do built into the product to try and make that really easy as well.
Yeah. Do the patients ever want to hear it? Like, I
Yeah.
mean, you can't do that, right? Because you're not storing the
So
recording.
we do generate a summary for both clinician and patient. Today, we leave it up to the clinician to share it with the patient. It can be really valuable because I think it gives them some skin in the game of why give consent to do this thing beyond just helping my clinician. But B, it's powerful. Just like the therapist, remembering what you covered last week is hard for any of us. We're all busy and sort of takes time to remember that context. So.
And then this is probably a dumb question, but there's so many tools out there in sort of in the healthcare world that listen in uh, on on conversations that patients are having with their primary care physician or with their specialist. There's tools that listen in on this session right here, and come up with a transcript afterwards. And like, what is special about what you've built compared to all these other tools? Like, why do we need another one of those?
Yeah. I think from the beginning of our company, one of the sort of core theses was therapists need and deserve purpose-built software. There really has not been many, if any, pieces of software designed specifically for the therapist, specifically to help them do their job better, however you define that, but like specifically for them. And so I think that's sort of been our belief from day one. With respect to scribes, there's a bunch of other AI scribes, even like human scribes are a thing, not for therapists typically, but for other healthcare professionals. And so when we think about sort of why us and why now and why we fit in and why do we even need to do this, right? There's a few reasons. Number one, therapists and their workflows are very unique. Most of the other AI scribe companies in the space, some of the ones who have raised lots and lots of money, they're focused on general healthcare, almost like horizontal across healthcare, and thus very focused on health systems and hospitals and academic medical centers. And if you think about the workflows first of a physician within one of those healthcare organizations versus the workflow of a therapist, they're very, very different. One of the most sort of concrete ways to see the difference is the average therapy appointment's 55 minutes long. The average physician appointment is about 15 or 17 minutes long, something like that. And then all the intricacies that go along with that. The other thing is the documentation needs are very, very unique. And so physicians can prescribe medications. And so they obviously typically want their documentation to incorporate medications as well as a bunch of other variables like previous medications and maybe allergies and medication history and all sorts of stuff that relate to medications. Therapists, on the other hand, they don't prescribe medication. And so they specifically need documentation that is quote unquote non-medical to sort of cover the types of interventions that they're doing and they're providing and the impact of those. And then I think the third piece is just the market stuff that we talked about earlier. The go-to-market to sort of reach most of healthcare, call it, is going to look very different because most of healthcare does live now within hospitals, health systems, AMCs, and mental health is just very different. And so I think without a vertically specific or purpose-built tool for therapists, they will sort of once again get left behind in some of these revolutions. And we're really determined to make that change. And so thus we go sort of very deep vertically within therapy. We don't sort of go outside of the walls of mental health. We'll veer a little bit outside of just therapists, but pretty straight shot towards therapists. And I think that's how we're unique and different. And we don't stand a chance if you compare us versus one of those other scribes when it's a cardiologist, but we win almost every time when it's a therapist using it in terms of the type of documentation and the workflow and all that.
Okay, so you've got this scribe, you got 12 million minutes recorded. It's going what? So you're creating these notes, but then I interrupted you a while back because you were going to talk, I think, about then what you do with that and how it is that you're not just saving the therapist's time in terms of the documentation, but you're also layering in a bunch of intelligence that provides information and insights to the therapist at certain times. Am I?
Exactly. Yeah. So one of the beautiful parts about the Scribe feature set or product is it very quickly builds this daily habit where therapists, once they hear about us and sign up for a free account and hopefully then convert to a paid account and start using this, they very quickly adopt to using this every single day with every single one of their patients or clients during every single one of their sessions. And so that sort of creates this surface area for us to go deeper. And the first place we're going deeper is how do we layer both before a session starts and after a session concludes helpful insights, helpful suggestions, helpful recommendations in certain cases based on the contents of the session that we had previously acquired and summarized and generated a note for. So there's sort of like two very clear use cases. The first is what we call pre-session prep. So this is right before a session starts, you get like a prep sheet as a therapist and it's bullet points and you can see it's some clinical and some sort of non-clinical. So non-clinical things are who this person is that you're seeing and maybe things like what their kids' names are, what their husband or wife's name is. And then you get all the way down to, hey, here's their treatment plan. Here's the goals you set out to make progress on their treatment plan. Here's their latest clinical assessment that shows their progress towards those goals. And it gives you places to sort of really dig in. Because again, think about the life of a therapist. They've got maybe 3, 4, 5, 6 minutes in between a session to prepare and get up to speed. And they're going to the bathroom, they're getting a quick bite to eat, they're sort of de-stressing and then re-ramping up. And so this is sort of that tool to help them get started. And then similarly, post-session, we will help them with sort of the takeaways and the action items. And that might be assigning a specific clinical assessment, or, hey, you talked about sleep as sort of a core thing that you want this client to work on. Maybe you want to assign them a tracker that can help them keep track of their sleep and log that out so that we can discuss it at the next session, things like that.
So this is a little bit of a tangent, but what you just described is, I'm not a therapist, but I have a lot of meetings with people. That would be amazing if I
Yeah.
could, like, next time I meet with you, something pops up and it's like, hey, reminder, here's, Danny's whatever, kids, and here's the name of his dog. And the last time you met, you talked about XYZ, and here's some prompts for how to pick up and continue the conversation or something like that. You know, I think I was thinking about, like, I got my haircut recently. Somehow I've known her for a very long time, but somehow she knows my dog, and like she remembers all this stuff. And I think she just has a really good memory. But this concept that you're describing could have applications, beyond just mental health. Is that, and again, it's probably a tangent, but do you have aspirations, or do you see your company being able to extend into other areas, or are the tools and the systems and everything that you've built really dependent and sort of focused on therapy?
I think there's room for innovation outside of therapy and sort of like key learnings that we're learning to sort of transpire over. However, for us as a company, we're staying incredibly focused on mental health and mental health professionals. I think there's a ton of opportunity there, and we want to go sort of deep on that space and add additional products and capabilities over time that sort of serve the mental health professional to let them do their best work. But I think we draw inspiration from day-to-day conversations and day-to-day sort of interactions like you described, because I sort of said earlier, there's a lot we don't know in the space in terms of what drives a high quality outcome. There's a lot of people thinking about that and working on that. One of the things we do know is that at least based on the research out today, the number one predictor of a positive outcome is therapeutic alliance, which sort of said simply is the strength of the relationship between a therapist and their client or patient. So you think about some of the stuff you mentioned, like remembering your dog's name, like that actually does help and actually can improve outcomes. But again, for us, sort of like really building and designing for the therapist use case is how we'll sort of like apply that. And I think that's just our focus, the brand we're building.
So getting back on track, sorry about my tangent, but the the information, the content that you're providing to the therapist to improve the quality of the interactions and the sessions that they have with their patients. What else are you providing beyond that, the sort of personal stuff, the recaps, you've got prompts, like how deep does that go? And how do you feel like where you are today compares to, if you think back 6 years, and the kind of insight that was driving you to start the company, that there's just this huge variability in quality and efficacy of care?
Yeah.
Uh, where are you in that journey today?
Yeah. Well, maybe I'll go in reverse order. So when we got started, it was all about collecting data from patients in between visits. And that sort of came in the form of clinical assessments, so capturing symptoms and symptom severity, typically through questionnaires that we would send them remotely and automatically, as well as through this concept in therapy called sort of worksheets or homework exercise that again, similarly, our sort of client or patient inputted information specific to their treatment and specific to their treatment plan that a therapist is sort of asking them to do or complete or share or log in some way. So we would go out and through our mobile app and our web app and text and email, we would automatically go and collect this information. We would serve it up to the clinician at the next visit, try and make it really easy to understand and act on and use in some way, shape, or form during that next session. And we made good headway here, but what we realized pretty quickly, maybe not pretty quickly, maybe it took us a few years, is that therapists are really, really busy. And so they didn't even have the headspace to think about this new thing, even though they were motivated to try and do whatever was within their power and whatever was possible to try and help the patient or client that they're treating and deliver the best outcome. Like, they're genuinely amazing people and motivated to do that, but they're just so underwater. And typically one of the driving factors was documentation. So that is sort of like, almost think of like we're on this journey and we took this pivot because it was actually going to let us create the space to then go and allow people to invest in this sort of new way of practicing. So one of the benefits of that is, over the first, call it 3 or 4 years, we built out this really robust, we call it like a clinical content library. So this is thousands of highly curated, but also pretty broad, evidence-based clinical assessments, homework assignments, symptom trackers, and now also therapeutic intervention. So these are like sort of the key components of what an evidence-based therapist will do before, during, after, between a session with their patients. They're like the sort of the things that drive outcomes or drive change or drive results, whatever those results may be. And so we have this really robust content library that we built up. What we're now able to do is surface up that content to the right clinician at the right time so they can deliver the right care. And it's much more of a personalized and almost like bite-sized experience, because again, therapists are busy, but also most of them weren't trained in all of this stuff. Most of them are not super analytical or data-driven inherently. Again, they're motivated to want to deliver the best possible care, but how we surface this stuff up to them is really important. And now, both with the Scribe product and then also with AI and the capabilities today, we can actually do that. So that's pretty exciting. Again, we're launching that product in a few weeks. More broadly, there's a small alpha cohort of users using it today, but we think there's a lot that we can pull from the early days, but apply in a much different way thanks to large language models and other AI methods today.
And is the 12 million minutes that you've I don't know what the right word is, transcribed, or that, that sort of flowed through this Scribe product, is some of that content library that you mentioned derived from those minutes and that data, or will it be as you go? And presumably at some point, I don't know whether it's 12 million or 100 million or a billion. I don't know where it needs to be, but at some point, theoretically, you're going to have so much data, and also longitudinal data, presumably about patient progress and what the interventions were, or what the type of counseling was, or the specific suggestions or things, and what worked and what didn't. Is that all stuff that you are able to capture from obviously from a technical point of view? You can capture all that, but obviously you're dealing with some very sensitive data and information. So to what extent are you able to capture that, build a system that learns from it, and then use that to inform and keep getting smarter about how you're helping and empowering therapists to just get better and better results?
Yeah, so we sort of view ourselves as stewards of the data. Like, really, it's the clinician or the practice that they work for and the patient jointly, sort of like their data. So we're sort of stewards of the data. They can keep their data on Blueprint, not the recording. That's sort of by design. We wipe that, but the transcription and the summaries that we generate, both clinician and patient facing, and then the clinical note. And so there's a bunch of valuable information there. They can turn those off. They can delete them. Most people keep them because there's a whole set of features that sort of come along with keeping them. And so as we look towards the future and some of the interesting things we could do, I think it's about giving people a reason to keep that data on there. We don't really want that data just for data's sake, but if we can give them a really compelling reason to use that data for their own benefit or for their patient's benefit, what we see today is most people are fine keeping that data on platform, so long as we've sort of built the appropriate level of trust up front. So there's a lot that we're thinking about, whether it be the content or deciphering the interventions, or even like there's some really interesting like research that could probably be plucked out of this, thinking about what drives the
Yeah.
best outcomes at scale. And so um, all of that's on the table for sure over the long term. I think there's a path for a lot of that. And I hope we can get there. It's exciting.
It's very exciting. Um, do you I just lost my train of thought because it's so interesting if you're able to generate enough data and use it and really apply it to a discipline that um where that hasn't happened as much as some other disciplines.
Exactly.
Um uh when you first started the company, there there was artificial intelligence, but not like there is today. Like it's a very different world
Yep.
today. And at at what point did did it sort of hit you that the tools that are becoming available can represent kind of a dramatic step change in the company and the capabilities and what did that journey look like?
Yeah. I mean, I was thinking about more machine learning and sort of the predictive aspects of artificial intelligence from the very beginning, but it was very different in how we thought we'd apply it. Just because always from day one, there was this data element, right? We hadn't really done much there other than think about how we're going to structure the data and think about it as a core asset that we're building up that we can then use for various reasons. So I think the light bulb really went on the sort of application and use case, like many other people, when OpenAI released ChatGPT and like everyone sort of experienced this like totally new, really powerful, mind-bending experience. And so we started to, I don't remember exactly when that was, I think late 2022, early 2023, we started to investigate and even incorporate really small bits of that in our product before we made this sort of stepwise change or launch. And I think to our benefit, so too did therapists. Like they were starting to explore this in their personal lives. I mean, everyone had been exposed, it seems like, to Chat GPT or some derivative solution in some way. And their numbers are sort of mind-boggling. And so that actually helped because then when we were coming to the therapist with this AI solution, they're like, oh yeah, I understand AI. And actually now, like a lot of them are out actively seeking AI to help them in their jobs. Some for documentation, some for whole other purposes. And I think all of that is thanks to some of the like consumer mass market, almost like adoption or even exposure, maybe just of AI and the benefits and breaking down maybe not all of the fear around AI and the future of technology. So
Got it. How have you've talked a lot about outcomes and sort of danced around it in different ways. Like, have you been able to measure or quantify, you can quantify on the efficiency side. It saves 5 or 10 or 15, however many hours of, you know, documentation and you could probably quantify. It probably wouldn't be that hard to quantify like pre-meeting prep. Maybe you already have done it, but it saves you X amount of time preparing. On the quality side, are you able to quantify outcomes improvements with Blueprint compared to without Blueprint?
yeah, we've done some case studies. It's definitely on our roadmap to sort of do more broad scale, wider, peer-reviewed type of research, and definitely with where we're going, it's a key part of that roadmap. But sort of in the pre-Scribe days, we did a bunch of case studies with customers where we had the opportunity during sort of an implementation period where we could sort of run this almost double blind, where there was some cohort of clinicians who were adopting and implementing and using Blueprint, and the efficacy really came from this process of measurement-based care, which has been pretty well studied. But measuring it, hey, how good is Blueprint at doing that? And then some other cohort were in the control and they were waiting and they would get access later, but they were second, and we could sort of measure outcomes. So it's not perfect because it's not looking at the same clinician doing it or not doing it. But when we did that, I think the largest case study we ran, which was across I want to say 500 or so patients over the course of a couple months. We saw about a 40% increase in speed in getting sort of a predefined level of response. So some level of response in the treatment that a therapist was doing, but actually getting there much, much faster. And if you think back to the trial and error, this data essentially, we think, helped them go through that trial and error process, figure out some type of intervention or treatment plan that would start to help them make progress. And there's other case studies we did that looked at different things, but that was always one that was really stark, which is I think it was 44% quicker treatment response when you use a tool like Blueprint, which is largely what a lot of the measurement-based care research, which has been around for something like 20 years, and there's tons and tons of studies on it, showed. But now actually seeing in a real world setting versus just in a research setting is also pretty cool.
Can you say more about that? 44% increase in the, or decrease, I guess, in the
Decrease.
time response. Say, I mean, I mean, to an untrained ear, that sounds pretty dramatic. Like, what,
Yeah.
that a
No,
little bit more.
yeah. So 44% quicker treatment response, which means it's all measured by these clinical assessments or clinical scales. So reaching a specific predefined, I can't remember what the specifics were on it, but some predefined change in symptom severity. And so let's just say it's we want to achieve a 10-point change on a depression scale, and we're going to define that as treatment response. We're responding to the treatment. We're not yet in full remission as is defined, but hey, there's some initial response that was happening much earlier on in that treatment journey. And so again, if you think back to sort of the ebbs and the flows and the trial and error of mental health and mental health care, like that can be really significant. Not just in the end all outcome, but also making sure someone gets there quicker. You know, can save lives. And we have had instances, sort of other instances where because we're capturing this information from the patient in unique ways, we can get that information to the provider, and the provider, more than one provider has told us this has helped keep a patient alive in certain cases. So it's really about collecting that information and then getting it to the provider and letting them do their thing. They're really well trained and really smart, and it's just about having access to this information in certain cases that can influence in a bunch of different ways.
I mean, I'm sure there's more work to do and more research, but does that also point to a direction where insurance companies would be interested in paying? I mean, that could save a lot of money if there's a
Totally.
44%, you know, they, you know,
Yeah,
somebody's got to pay for all this stuff. So
that's definitely the goal. I think I would say 3-4 years ago we thought that change would happen quicker. But we're encouraged by what's happened in the last, call it 12 months. And I think we're seeing, the insurance companies are very large companies, so inherently they just, like, it takes time for the stuff to work through the system. But I think we're seeing more change and more urgency, and we're talking to a number of them now to try and structure different incentives and programs. And we're really sort of just the middleman to help make this process easier. But they're now sort of fully bought into this as a thing that improves outcomes, and in some ways, most importantly to them, saves them dollars, which sort of moves the needle for them. I think it's changing now in terms of like their willingness to prioritize something like this, value-based care, specifically in behavioral health, in part because a lot of the costs have gone up in the last 5 years as utilization has gone up. And part of that is because we actually have made a lot of good progress on the access front. Part of that is some of the implications of COVID, and the demand for and the need for mental health care has gone way up. And now, sort of in a lag period, the payers are looking at their 2022 or 2023 costs, and all of a sudden behavioral health, and in particular outpatient behavioral health, which is where most of the care happens, has entered the top 5 or top 3 or top 10. It's got the eyeballs now, and so that's really exciting, because I do think for us to see really long lasting change at the scale that I think we all want, like obviously the payers have to be involved in this in some way, shape, or form to drive outcomes and appropriately incentivize the right outcomes. So
yeah. All right. I want to ask you about, in the absence of payers, just from an entrepreneurial business point of view, how you go to market with something like this. But before I do that, there's a bunch of people who've asked questions related to the LLM that you're using. So just, can you just describe, I know you didn't build your own LLM, and I'm very happy that you didn't, because
Me too.
that's probably not the best use of resources, but like, what are you using, and how do you train it differently than, what comes off the shelf, and is how customized is it?
Yeah, we use a combination of a couple, both OpenAI and Anthropic and some of their different models. And the way I think about it is it's like sort of this pipeline. We also use different tools to help with transcription, um, which is not really LLMs, but sort of in that sphere. So we think of it as this pipeline, and the pipeline really is focused on the end user for us. So just maybe to break it down a little bit further. So we transcribe a session. That's pretty straightforward. You just want it to be really accurate, and that sort of serves as the ingredients for everything to come. But once we do that, we generate a few different summaries from that transcription. One of them is a summary for the clinician. One of them is a summary for the patient. We also generate a couple other summaries from the viewpoint of different stakeholders. So in particular, one we do is a summary as if you were an auditor. So I'm an auditor and I'm reviewing this transcript. What's my sort of summary and opinion? And then we use all those summaries to ultimately generate a note. And we have these two agents sort of working in tandem. One is generating a note to the liking of the clinician. So they've inputted through our interface lots of preferences. We understand some of the changes they've made to previous notes we've generated for them, and we track all of that, where they're making edits, what templates they're using, what sections they're using, etc. So one version of the note is like, hey, here's the best possible note from the clinician's perspective. The other is playing the role of an auditor and looking at, oh, this note's out of compliance here, it's out of compliance there, it's in compliance there. And these two things sort of work in tandem. Almost imagine like two people having a conversation and ultimately bringing the best of both parts and then presenting that through the interface to the clinician. So there's all sorts of like fine tuning and training and prompting and workflow implications that go into it. It's funny. It sounds like sort of simple when you think of it. Oh, we just transcribe it, we throw it into ChatGPT, and away we go. And that can get you some of the way there, but to like really do this at scale and do it well, it's intricate. I wish it was easier, but it's challenging. And there's a whole bunch of other sort of implications that we think about too.
Yeah, it doesn't sound simple to me anymore. I mean, not that it did to begin with, but it certainly doesn't
We
anymore.
want it to sound really, really simple when we describe how it works, right? Because it's like three
Yeah.
clicks and you have this magical solution.
How do you, just last point on this, it- one of the concerns about ChatGPT, OpenAI, is that anything you put in there goes into their system, and presumably there's some extra level of sensitivity around the data that you are generating. So how do you manage that?
Yeah, so we're on an enterprise contract with all of these vendors, and so as part of that, they don't train on any of the data that we send with them. We also do a bunch of stuff on our end to do things like redact PHI before we send it. We have BAAs with all of them too, but just as like an extra layer, we
Yeah.
redact and then we'll sometimes reinsert depending on the need. Like for example, if we want to include a client's name in the note, well, we'll redact that before we send from the transcript, and then we'll reinsert it on our end because we know who that client is in our system. So there's all sorts. We sort of try and build a firewall, but we also have pretty deep partnerships and relationships now with some of these companies. And they've structured it in a way to sort of meet the exact same potential problem that you're calling out. I think like the bigger problem than the like fundamental technical how it works is really just the perception and the trust, because most people don't know that, right? And most people will, even if that's the truth, they'll assume something else. And so it's really about designing this experience in a way that builds trust over time. We can't expect them to share everything and open up, although some people do open up their practice and all their patients right out of the gate. But how do we do that over time, incrementally, to sort of continue building that trust?
Got it. All right, we don't have a lot of time left, but I find it really interesting because, most of the healthcare companies we work with are, really it's a much more of a B2B sale and environment than what you're dealing with. I mean, you're trying to sell, I think, that 700 or 800,000 mostly individual practitioners.
Yep.
Is this where your background in, consumer fashion and safety kind of really helps you, or how do you go to market with something like that?
Yeah, but funny enough, I think it does in a little way. It's not like that was planned out or anything, but we we are a healthcare company, but especially in terms of our go to market, we look more like a sort of like SMB B2B company, or even a B2C company. Sometimes we use the term prosumer internally as like what our sort of motion is with respect to go to market. So we are really, really focused on what we call the practitioner. So it's the therapist in most cases, but any practitioner, that's who we're marketing to, that's who we're speaking to, that's who we're designing for on our website. And the way we reach those is primarily through inbound. So we do a bunch of advertising and marketing and organic and sort of word of mouth, but we're always thinking about the practitioner. And that's not because we don't want to reach the organization that employs 1,000 of those practitioners. It's just that that's the biggest bang for the buck, and that is really how we can have our messaging be most clear and pure. And so what ends up happening is those practitioners hear about us, they come to our website, they sign up. It's largely self-serve, especially for the individual practitioners. It's entirely self-serve. So they sign up, they can record their first session, they can see their first note. They get 5 free notes out of the gate. If and when they're ready, they can upgrade to a paid plan, and away they go. And so most of our customers, that's how they interact. What's interesting is about 25% of the signups we get are people who are part of a group, either small, medium, or large. And so we actually, through that process of marketing to the practitioner, build this bottom-up strategy as well, where now we have, because a lot of them are 1099s within these groups, they actually do have some leeway to use the tools that they want for their job. And so we're able to reach some of those organizations in a bottom-up way, and that sort of serves as signal for our sales team to then go and reach out to the clinical director at XYZ, because hey, they've actually got 6 therapists at their company using Blueprint every single day. Some of them are even paying for it on their own credit card. And so it's like warm leads for us on that front. And then we go top down. But really that combination and sort of the practitioner focused go to market is how we think about it.
Well, so where can listeners go to learn more about Blueprint?
Yeah, so our website, blueprint-health.com. We're also relatively active on LinkedIn and Instagram and Facebook and all the other channels. You can also email me directly. My email is danny@blueprint-health.com. And yeah, hopefully this was enjoying. I know I sure enjoyed it, but would love to chat with anyone who wants to go a little deeper.
Well, thank you so much. Really appreciate it. Very much enjoyed the conversation. I think it's fascinating what you're building, and I wish you the best of luck as you continue on this journey. To everyone else who joined, if you like this conversation, I'll be talking with a gentleman named Omer Golan tomorrow about, he's also in the AI mental health care space. He's building a not-for-profit technology company called My What If, which is using AI to help people get through PTSD and other forms of trauma. You can learn about that, sign up for it, learn about any of our other events at our website, which is matter.health. And thanks everybody for joining. I hope you enjoy the rest of your day.
Thanks so much.